20-year-old female is prescribed a drug intended to treat depression by augmenting a specific neurotransmitter in the brain. Side effects of this drug include decreased sexual desire, nausea, and diarrhea. The specific neurotransmitter affected by this drug is released primarily from which area of the brain? A. Locus ceruleus. B. Raphe nuclei. C. Nucleus accumbens. D. Basal ganglia. E. Ventral tegmental area. Answer B. Based on the drug's indication, depression, and the listed side effects, you can infer that the drug works on serotonin, which is released from the raphe nuclei. The locus ceruleus is the source of norepinephrine. The nucleus accumbens and ventral tegmental area are associated with dopamine. Multiple neurotransmitters, including gamma-aminobutyric acid, GABA, dopamine, and acetylcholine, are active in the basal ganglia, but serotonin is not one of them. 2. A 28-year-old male is released from the psychiatric hospital following an acute psychotic episode. Several months later, he comes into the clinic complaining that he is developing breast tissue. This is likely due to a medication's effects on which of the following areas of the brain? A. Mesolimbic pathway. B. Mesocortical pathway. C. A tuberoinfundibular pathway. D. Ventral tegmental area. E. Nigrostriatal pathway. Answer C. Given the patient's recent psychotic episode, it is likely that an antipsychotic drug that blocks dopamine was administered. Blocking dopamine increases prolactin levels, which can result in breast enlargement and milk discharge, effects that may be confusing or embarrassing. This occurs due to dopamine's role in the tuberoinfundibular pathway. The mesolimbic pathway is involved in positive symptoms, while the mesocortical pathway is implicated in negative symptoms. The ventral tegmental area is related to the addictive potential of certain substances, and alterations in the nigrostriatal pathway are involved in involuntary movements such as Parkinsonism. 3. A 31-year-old male is brought into the emergency department by paramedics who report that the patient was found unresponsive in his bathroom with an empty, unlabeled bottle of pills nearby. Vital signs are normal except for a breathing rate of 4 breaths per minute. On examination, the patient has constricted pupils. An electrocardiogram is normal. What medication did the patient most likely take? A. An antidepressant. B. An antipsychotic. C. A mood stabilizer. D. A stimulant. E. An analgesic. Answer E. There are several clues in the clinical scenario that suggest an opioid overdose, particularly the slowed breathing rate and the constricted pupils. None of the other medication classes would cause this clinical presentation in overdose. 4. An 18-year-old female college student is brought into the emergency department complaining of feeling like my head is going to explode. She is profoundly confused. On examination, she has noticeable facial flushing and profuse sweating. Loose stools are noted in her clothing. Vital signs show heart rate of 110 and temperature of 101.7 degrees Fahrenheit. Neurological examination reveals muscular twitching and increased reflexes. What neurotransmitter is most likely in excess? A. Acetylcholine. B. Serotonin. C. Norepinephrine. D. Gamma-Aminobutyric acid, GABA. E. Glutamate. Answer B. This is a classic presentation of serotonin syndrome: flushing, sweating, altered mental status, rapid heart rate, fever, tremor, diarrhea, and increased reflexes. Excesses in the other neurotransmitters would not present with this particular clinical picture. 5. Which of the following is not a function of acetylcholine? A. Slowing digestion. C. Muscle contraction. D. Memory. E. Penile erection. Answer: acetylcholine is part of the parasympathetic nervous system and increases the rate of digestion, rather than slowing it. The other options are correctly identified as functions of acetylcholine. 6. A 65-year-old male with Alzheimer's disease is prescribed a medication to enhance cognition. This drug most likely targets which neurotransmitter? A. Dopamine. B. Serotonin. C. Acetylcholine. D. Gamma-Aminobutyric acid, GABA. E. Glutamate. Answer: C. Acetylcholine. Cholinesterase inhibitors, such as donepezil, increase acetylcholine levels, which can improve memory in patients with Alzheimer's disease. 7. A 30-year-old female experiences severe anxiety and is prescribed a benzodiazepine. This drug potentiates the effects of which neurotransmitter? A. Norepinephrine. B. Serotonin. C. Gamma-Aminobutyric acid, GABA. D. Glutamate. E. Opioid. Answer: C. Gamma-Aminobutyric acid. Benzodiazepines enhance the inhibitory effects of GABA, leading to reduced anxiety. 8. A 25-year-old male overdoses on a recreational drug and presents with high body temperature, agitation, and dilated pupils. Which neurotransmitter is most implicated? A. Serotonin. B. Norepinephrine. C. Acetylcholine. D. Glutamate. E. Dopamine. Answer: B. Norepinephrine. The symptoms suggest sympathetic overactivation, as seen in toxicity from substances such as cocaine or amphetamines. 9. A patient with schizophrenia develops muscle rigidity and tremors after starting haloperidol. Blockade of which pathway causes these symptoms? A. Mesolimbic. B. Nigrostriatal. C. A tuberoinfundibular. D. Mesocortical. E. Raphe nuclei. Answer: B. Nigrostriatal. Dopamine blockade in this pathway leads to extrapyramidal symptoms resembling Parkinson's disease. 10. A 40-year-old female with depression reports weight gain and sedation after starting medication. Which neurotransmitter is most affected? A. Serotonin. B. Norepinephrine. C. Histamine. D. Dopamine. E. Glutamate. Answer: C. Histamine. Antihistaminergic effects, such as those caused by tricyclic antidepressants or mirtazapine, can lead to sedation and weight gain. 11. A 70-year-old male with a history of alcohol use disorder is given a gamma-aminobutyric acid, GABA, receptor antagonist to treat overdose. Which drug is this? A. Naloxone. B. Flumazenil. C. Atropine. D. Physostigmine. E. Benztropine. Answer: B. Flumazenil. Flumazenil is used to reverse the effects of benzodiazepine overdose. It acts as a gamma-aminobutyric acid type A, GABA-A, receptor antagonist, thereby counteracting the sedative effects of benzodiazepines. 12. A 70-year-old female with osteoporosis is advised to avoid selective serotonin reuptake inhibitors. Excess serotonin may affect which bone-related neurotransmitter? A. Glutamate. B. Norepinephrine. C. Acetylcholine. D. Dopamine. E. Gamma-aminobutyric acid. Answer: A. Glutamate. Serotonin interacts with glutamatergic pathways, which are involved in bone remodeling. Excess serotonin can influence these pathways and negatively impact bone health. 13. A patient with Huntington's disease has choreiform movements due to degeneration of neurons releasing which neurotransmitter? A. Gamma-aminobutyric acid. B. Dopamine. C. Serotonin.
D. Acetylcholine. E. Norepinephrine. Answer: a gamma-aminobutyric acid. The hallmark of Huntington's disease is degeneration of gamma-aminobutyric acid-releasing neurons in the striatum. This loss leads to disinhibition of motor pathways and results in choreiform movements.
14. A 10-year-old male with attention deficit hyperactivity disorder is prescribed methylphenidate, which increases activity in which brain pathway? A. Tuberoinfundibular. B. Mesocortical. C. Nigrostriatal. D. Mesolimbic. E. Raphe nuclei. Answer: B. Mesocortical. Methylphenidate enhances dopamine transmission in the mesocortical pathway. This improves attention and executive function in individuals with attention deficit hyperactivity disorder. 15. A 60-year-old male taking a monoamine oxidase inhibitor eats aged cheese and develops a hypertensive crisis. Excess of which neurotransmitter causes this? A. Serotonin. B. Norepinephrine. C. Acetylcholine. D. Glutamate. E. Histamine. Answer: B. Norepinephrine. Tyramine in aged cheese leads to the release of norepinephrine. Because monoamine oxidase is inhibited, norepinephrine is not broken down, leading to excessive accumulation and a hypertensive crisis. 16. A 22-year-old female with epilepsy is prescribed a drug that blocks voltage-gated sodium channels and enhances gamma-aminobutyric acid activity. Which neurotransmitter is indirectly boosted? A. Glutamate. B. Gamma-aminobutyric acid. C. Dopamine. D. Serotonin. E. Acetylcholine. Answer: B. Gamma-aminobutyric acid. Medications like valproic acid increase gamma-aminobutyric acid activity, leading to reduced neuronal excitability and decreased seizure frequency. 17. A 50-year-old male with erectile dysfunction is prescribed sildenafil. This drug enhances the effect of which neurotransmitter? A. Acetylcholine. B. Nitric oxide. C. Dopamine. D. Norepinephrine. E. Serotonin. Answer: B. Nitric oxide. Although not a classic neurotransmitter, nitric oxide mediates vasodilation critical for penile erection. Sildenafil enhances the nitric oxide cyclic guanosine monophosphate pathway by inhibiting phosphodiesterase type 5. 18. A 35-year-old female presents with insomnia and nightmares after abruptly discontinuing a medication. Which neurotransmitter withdrawal is implicated? A. Gamma-aminobutyric acid. B. Serotonin. C. Norepinephrine. D. Acetylcholine. E. Glutamate. Answer: a gamma-aminobutyric acid. Abrupt discontinuation of benzodiazepines reduces gamma-aminobutyric acid-mediated inhibition in the brain, resulting in symptoms of hyperarousal such as insomnia and vivid dreams or nightmares. 19. A 27-year-old male with opioid use disorder is given naloxone. Which receptor does this drug block? A. Mu-opioid. B. N-methyl-D-aspartate. C. Dopamine D2. D. Serotonin 5-hydroxytryptamine type 3. E. Muscarinic. Answer: a. Mu-opioid. Naloxone is a competitive antagonist at mu-opioid receptors. It is used to reverse the effects of opioid overdose, including respiratory depression and sedation. 20. A 45-year-old female with migraines is prescribed sumatriptan. This drug agonizes which neurotransmitters receptors? A. Dopamine. B. Serotonin, specifically 5-hydroxytryptamine type 1B and 1D. C. Gamma-aminobutyric acid. D. Glutamate.
E. Acetylcholine. Answer, B. Serotonin.
Sumatriptan activates serotonin 5-hydroxytryptamine type 1b and 1d receptors, leading to vasoconstriction of cranial blood vessels and relief of migraine symptoms.
21. A 30-year-old male with hypertension is prescribed clonidine. This drug reduces sympathetic outflow by acting on which neurotransmitter? A. Norepinephrine. B. Dopamine. C. Acetylcholine. D. Gamma-Aminobutyric acid. E. Serotonin. Answer, Norepinephrine.
Clonidine is an alpha-2 adrenergic receptor agonist that decreases norepinephrine release from presynaptic neurons, thereby reducing sympathetic tone and lowering blood pressure.
22. A patient with major depressive disorder undergoes electroconvulsive therapy. Which neurotransmitter's release is most enhanced? A. Serotonin. B. Norepinephrine. C. Dopamine. D. Gamma-Aminobutyric acid. E. Glutamate. Answer, E. Glutamate. Electroconvulsive therapy is thought to enhance glutamate release and neuroplasticity.
This contributes to its antidepressant effects, especially in treatment-resistant depression.
23. A 55-year-old male with bipolar disorder is prescribed lithium. This drug reduces excitatory neurotransmission by inhibiting which system? A. Dopaminergic. B. Glutamatergic. C. Cholinergic. D. Histaminergic. E. Gamma-Aminobutyric acidergic. Answer, B. Glutamatergic.
Lithium reduces glutamatergic neurotransmission by modulating intracellular signaling pathways, helping stabilize mood in bipolar disorder.
24. A 5-year-old male with absence seizures is prescribed ethosuximide. This drug targets T-type calcium channels in neurons releasing which neurotransmitter? A. Gamma-Aminobutyric acid. B. Glutamate. C. Dopamine. D. Serotonin. E. Acetylcholine. Answer, A. Gamma-Aminobutyric acid. Ethosuximide acts on T-type calcium channels, especially in thalamocortical neurons.
These neurons help regulate the balance of excitatory and inhibitory neurotransmission involving gamma-aminobutyric acid.
25. A 70-year-old male with benign prostatic hyperplasia complains of dry mouth after starting medication. Which neurotransmitter is antagonized? A. Acetylcholine. B. Norepinephrine. C. Dopamine. D. Serotonin. E. Gamma-Aminobutyric acid. Answer, A. Acetylcholine.
Anticholinergic medications used to manage urinary symptoms in benign prostatic hyperplasia can block acetylcholine receptors, leading to side effects such as dry mouth.
26. A 45-year-old M with myasthenia gravis is prescribed pyridostigmine. This drug improves symptoms by enhancing the activity of which neurotransmitter? A. Dopamine. B. Acetylcholine. C. GABA. D. Serotonin. E. Glutamate. Answer, B. Acetylcholine.
Pyridostigmine is a cholinesterase inhibitor, increasing ACH at neuromuscular junctions to improve muscle strength.
27. A 30-year-old F with insomnia is prescribed zolpidem. This drug primarily potentiates which neurotransmitter system? A. Glutamate. B. Norepinephrine. C. GABA. D. Dopamine. E. Serotonin. Answer C. GABA. Zolpidem enhances GABA-A receptor activity, promoting sedation.
28. A 50 years old M with bipolar disorder stabilizes on lithium. Lithium's therapeutic effect is partly due to modulation of which excitatory neurotransmitter? A. Glutamate. B. Dopamine. C. Acetylcholine. D. Histamine. E. Serotonin. Answer: of glutamate. Lithium reduces glutamate signaling, preventing excitotoxicity in manic episodes. 29. A 25 years old M is found unresponsive with shallow breathing in pinpoint pupils. Naloxone reverses these symptoms by antagonizing which receptors? A. NMDA. B. Mu-opioid. C. D2 dopamine. D. 5-HT3. E. Muscarinic. Answer: B. Mu-opioid. Naloxone reverses opioid overdose by blocking mu-opioid receptors. 30. A 60 years old F1 phenylzyme, MAOI, develops a hypertensive crisis after eating cheddar cheese. Excess which neurotransmitter causes this? A. Serotonin. B. Norepinephrine. C. GABA. D. Histamine. E. Acetylcholine. Answer: A. B. Norepinephrine. Tyramine in cheese displaces NE vesicles, which cannot be metabolized due to MAO inhibition. 31. A 70 years old M with Alzheimer's shows cognitive improvement on donepezil. Which neurotransmitter deficiency does this drug address? A. Dopamine. B. Acetylcholine. C. Serotonin. D. GABA. E. Glutamate. Answer: B. Acetylcholine. Donepezil inhibits ACH breakdown, compensating for cholinergic deficits in Alzheimer's. 32. A 55 years old F1 haloperidol develops repetitive lip-smacking movements. This tardive dyskinesia results from chronic blockade of which pathway? A. Mesolimbic. B. Nigrostriatal. C. A tuberoinfundibular. D. Mesocortical. E. Raphe nuclei. Answer: B. Nigrostriatal. Prolonged D2 blockade in this dopamine pathway leads to involuntary movements. 33. A 28 years old F abruptly stops paroxetine and experiences dizziness and electric shock sensations. This is due to sudden depletion of which neurotransmitter? A. Serotonin. B. Norepinephrine. C. Dopamine. D. GABA. E. Glutamate. Answer: A. Serotonin. SSRI discontinuation syndrome reflects rapid drops in serotonin activity. 34. A 22 years old M using cocaine reports intense euphoria. This is primarily mediated by increased dopamine in which pathway? A. Tuberoinfundibular. B. Mesocortical. C. Nigrostriatal. D. Mesolimbic. E. Raphe nuclei. Answer: D. Mesolimbic. Dopamine surge here reinforces reward and pleasure, driving addiction. 35. A 60 years old M with Parkinson's is given benztropine to reduce tremors. This drug acts by antagonizing which neurotransmitter? A. Acetylcholine. B. Dopamine. C. GABA. D. Serotonin. E. Glutamate. Answer: A. Acetylcholine. Anticholinergics restore balance in the striatum by reducing ACH activity. 36. A 40 years old F with allergic rhinitis takes diphenhydramine. Sedation occurs due to blockade of which neurotransmitters receptors? A. Histamine. B. Serotonin. C. Norepinephrine.
D. Dopamine. E. GABA. Answer A. Histamine. Antihistamines block H1 receptors, causing drowsiness.
37. A 10-year-old M with absence seizures is prescribed ethosuximide.
This drug stabilizes thalamic neurons by modulating which ion channels? A. Sodium. B. Calcium, T-type. C. Potassium. D. Chloride. E. Magnesium. Answer B. Calcium, T-type. Ethosuximide reduces thalamocortical bursts by inhibiting T-type Ca superscript 2 channels.
38. A 35-year-old F presents with hallucinations and hyperthermia after taking an overdose of dextromethorphan.
Excess activity of which neurotransmitter is implicated? A. Glutamate. B. Serotonin. C. Dopamine. D. Acetylcholine. E. GABA. Answer B. Serotonin.
Dextromethorphan in high doses inhibits serotonin reuptake, causing serotonin syndrome. 39. A 50-year-old M with schizophrenia develops gynecomastia. This is due to antipsychotic blockade of dopamine in which pathway? A. Mesolimbic. B. Mesocortical. C. A tuberoinfundibular. D. Nigrostriatal. E. Raphe nuclei. Answer C. Tuberoinfundibular. Dopamine normally inhibits prolactin, its blockade here elevates prolactin, causing breast tissue growth. 40. A 30-year-old F with migraine takes ergotamine. This drug constricts cranial vessels by agonizing which neurotransmitters receptors? A. Serotonin, 5-HT1B. B. Dopamine. C. GABA. D. Glutamate. E. Acetylcholine. Answer A. Serotonin, 5-HT1B. Ergotamine activates 5-HT1B receptors, reducing vasodilation. 41. A 65-year-old M with depression is prescribed mirtazapine, causing weight gain. This side effect is due to antagonism of which neurotransmitters receptors? A. Histamine, H1. B. Serotonin, 5-HT2C. C. Dopamine, D2. D. Norepinephrine, alpha 1. E. Acetylcholine, M1. Answer A. Histamine, H1. H1 receptor blockade increases appetite and sedation. 42. A 27-year-old M with alcohol use disorder is given disulfiram. This drug inhibits metabolism of which neurotransmitters aldehyde? A. GABA. B. Dopamine. C. Serotonin. D. Acetylcholine. E. Glutamate. Answer B. Dopamine. Disulfiram blocks acetaldehyde dehydrogenase, increasing acetaldehyde and dopamine metabolites to deter drinking. 43. A 5-year-old F with infantile spasms is treated with vigabatrin. This drug raises levels of which neurotransmitter? A. GABA. B. Glutamate. C. Dopamine. D. Serotonin. E. Acetylcholine. Answer A. GABA. Vigabatrin inhibits GABA transaminase, increasing GABA to suppress seizures. 44. A 70-year-old F with osteoporosis is cautioned against long-term SSRI use. Serotonin may inhibit bone formation by interacting with which receptor? A. B. 5-HT2B. C. 5-HT3. D. 5-HT4. E. 5-HT transporter. Answer B. 5-HT2B.
Serotonin via 5-HT2B receptors on osteoblasts reduces bone formation.
45. A 45 years old M with hypertension is prescribed propranolol.
This drug antagonizes which neurotransmitters receptors? A. Norepinephrine, beta 1. B. Dopamine, D2. C. Acetylcholine, M3. D. Serotonin, 5-HT2A. E. GABA, GABA A. Answer A. Norepinephrine, beta 1. Propranolol blocks beta 1 adrenergic receptors, reducing cardiac output.
46. A 30 years old F with narcolepsy is prescribed modafinil.
This drug increases wakefulness by enhancing which neurotransmitter? A. Dopamine. B. Serotonin. C. GABA. D. Histamine. E. Glutamate. Answer A. Dopamine. Modafinil inhibits dopamine reuptake, promoting arousal.
47. A 55 years old M with GERD develops confusion and urinary retention on omeprazole and oxybutynin.
Which neurotransmitter is antagonized? A. Acetylcholine. B. Dopamine. C. Serotonin. D. GABA. E. Glutamate. Answer A. Acetylcholine. Oxybutynin is anticholinergic, causing central and peripheral antimuscarinic effects.
48. A 20 years old M presents with agitation, hyperreflexia, and clonus after starting linezolid with sertraline.
Which neurotransmitter excess explains this? A. Serotonin. B. Dopamine. C. Norepinephrine. D. Glutamate. E. GABA. Answer A. Serotonin. Linezolid is a weak MAO inhibitor. Combined with SSRI, it causes serotonin syndrome.
49. A 50 years old F with chemotherapy-induced nausea is prescribed ondansetron.
This drug blocks which neurotransmitters receptors? A. Serotonin, 5-HT3. B. Dopamine, D2. C. A histamine, H1. D. Acetylcholine, M1. E. Substance P, NK1. Answer I. A serotonin, 5-HT3. Ondansetron antagonizes 5-HT3 receptors in the gut and chemoreceptor trigger zone.
50. A 60 years old M with major depression fails SSRIs and starts selegiline.
This drug inhibits metabolism of which neurotransmitter? A. Dopamine. B. Norepinephrine. C. Serotonin. D. Acetylcholine. E. GABA. Answer A. Dopamine. Selegiline is an MAOB inhibitor, increasing dopamine levels in Parkinson's and depression.
51. A 75 years old M with Parkinson's disease develops vivid hallucinations.
His medication list includes benztropine. Which neurotransmitter's antagonism most likely contributes to this side effect? A. Acetylcholine. B. Dopamine. C. Serotonin. D. GABA. E. Glutamate. Answer A. Acetylcholine.
Anticholinergics like benztropine block muscarinic receptors, leading to confusion and hallucinations. 52. A 40-year-old female with anxiety overdoses on diazepam.
Which antidote reverses this toxicity by targeting gamma-aminobutyric acid type A, GABA A, receptors? A. Naloxone. B. Flumazenil. C. Physostigmine. D. Atropine. E. Digoxin immune fragment antibody. Answer B. Flumazenil.
It antagonizes benzodiazepines at gamma-aminobutyric acid type A, GABA A, receptors. 53. A 30-year-old male starting fluoxetine reports nausea and diarrhea.
These symptoms are due to increased activity of which neurotransmitter in the gastrointestinal tract? A. Serotonin. B. Dopamine. C. Acetylcholine. D. Histamine. E. Norepinephrine. Answer: A. Serotonin.
Selective serotonin reuptake inhibitors, SSRIs, increase serotonin in enteric neurons, stimulating gastrointestinal motility. 54. A 45-year-old female on haloperidol develops restlessness and an inability to sit still. Blockade of which pathway causes this akathisia? A. Mesolimbic. B. Nigrostriatal. C. A tuberoinfundibular. D. Mesocortical. E. Raphe nuclei. Answer: B. Nigrostriatal. Dopamine blockade in this pathway disrupts motor regulation, leading to akathisia. 55. A 10-year-old male with attention deficit hyperactivity disorder shows improved focus on methylphenidate. This drug primarily enhances which neurotransmitters? A. Serotonin and Gamma-Aminobutyric acid. B. Dopamine and norepinephrine. C. Acetylcholine and glutamate. D. Histamine and opioid. E. Gamma-Aminobutyric acid and glutamate. Answer: B. Dopamine and norepinephrine. Stimulants block the reuptake of these neurotransmitters, improving attention. 56. An 80-year-old female with Alzheimer's disease experiences worsened confusion after starting oxybutynin for incontinence. Which neurotransmitter is antagonized? A. Acetylcholine. B. Dopamine. C. Serotonin. D. Gamma-aminobutyric acid. E. Glutamate. Answer: A. Acetylcholine. Anticholinergic medications worsen cognitive deficits in Alzheimer's disease. 57. A 35-year-old male presents with hyperthermia, rigidity, and altered mental status after combining fluoxetine with tramadol. Which diagnosis is most likely? A. Neuroleptic malignant syndrome. B. Serotonin syndrome. C. Malignant hyperthermia. D. Anticholinergic toxicity. E. Opioid withdrawal. Answer: B. Serotonin syndrome. Tramadol and selective serotonin reuptake inhibitors synergistically increase serotonin. 58. A 50-year-old male on morphine for chronic pain reports severe constipation. Activation of which receptors in the gastrointestinal tract causes this? A. Mu-opioid. B. Dopamine D2. C. Serotonin 5-HT3. D. Nicotinic. E. N-methyl-D-aspartate, NMDA. Answer: A. Mu-opioid. Opioids reduce gut motility via enteric mu-opioid receptors. 59. A 60-year-old female on phenelzyne, a monoamine oxidase inhibitor, eats smoked salmon and develops a throbbing headache and hypertension. Excess of which neurotransmitter is responsible? A. Norepinephrine. B. Serotonin. C. Dopamine. D. Acetylcholine. E. Gamma-aminobutyric acid. Answer: A. Norepinephrine. Tyramine in smoked fish displaces norepinephrine vesicles, unopposed by monoamine oxidase A inhibition. 60. A 25-year-old male with alcohol use disorder experiences seizures during withdrawal. Which neurotransmitter's sudden lack of potentiation is implicated? A. Gamma-aminobutyric acid. B. Glutamate. C. Dopamine. D. Serotonin. E. Acetylcholine. Answer: A. Gamma-aminobutyric acid. Chronic alcohol enhances gamma-aminobutyric acid inhibition, withdrawal reduces it, causing hyperexcitability. 61. A 55-year-old male with gastroesophageal reflux disease takes cimetidine. Which neurotransmitters receptor does this drug block? A. Histamine type 2. B. Serotonin type 3. C. Dopamine type 2. D. Acetylcholine type 3. E. Gastrin. Answer: A. Histamine type 2. Cimetidine reduces stomach acid by blocking histamine type 2 receptors. 62. A 70-year-old female with osteoporosis is advised to avoid long-term glucocorticoids. Excess of which neurotransmitter exacerbates bone loss? A. Glutamate. B. Serotonin. C. Norepinephrine. D. Acetylcholine. E. Gamma-Aminobutyric acid. Answer: A. Glutamate. Excess glucocorticoids increase glutamate, promoting osteoclast activity. 63. A 30-year-old female with schizophrenia develops galactorrhea. Blockade of which pathway explains this? A. Tuberoinfundibular. B. Mesolimbic. C. Nigrostriatal. D. Mesocortical. E. Raphe nuclei. Answer: A. Tuberoinfundibular. Dopamine blockade in this pathway increases prolactin, causing lactation. 64. A 5-year-old male with cerebral palsy receives baclofen for spasticity. This drug mimics which neurotransmitter? A. Gamma-aminobutyric acid. B. Glutamate. C. Dopamine. D. Serotonin. E. Acetylcholine. Answer: A. Gamma-aminobutyric acid. Baclofen is a gamma-aminobutyric acid type B agonist, reducing muscle spasticity. 65. A 45-year-old male with depression takes bupropion. Which neurotransmitters does this drug primarily affect? A. Dopamine and norepinephrine. B. Serotonin and gamma-aminobutyric acid. C. Glutamate and acetylcholine. D. Histamine and opioid. E. Substance P and neurokinin. Answer: A. Dopamine and norepinephrine. Bupropion inhibits their reuptake, aiding mood and focus. 66. A 60-year-old male with bradycardia is given atropine. Which neurotransmitter's receptor is antagonized? A. Acetylcholine, muscarinic. B. Norepinephrine, alpha-1. C. Dopamine, D2. D. Serotonin, 5-hydroxytryptamine 2A. E. Gamma-aminobutyric acid, GABA. Answer: A. Acetylcholine, muscarinic. Atropine blocks parasympathetic muscarinic receptors, increasing heart rate. 67. A 20-year-old female with bulimia nervosa is prescribed fluoxetine. Which neurotransmitter's reuptake is inhibited to reduce binge eating episodes? A. Serotonin. B. Dopamine. C. Norepinephrine. D. Glutamate. E. Gamma-aminobutyric acid. Answer: A. Serotonin. Selective serotonin reuptake inhibitors such as fluoxetine help regulate impulse control in eating disorders. 68. A 50-year-old male with chronic pain develops tolerance to morphine. Which receptor's downregulation is most involved? A. Mu-opioid. B. N-methyldiaspartate, NMDA. C. Dopamine D2. D. Serotonin, 5-hydroxytryptamine 1A. E. Gamma-aminobutyric acid, GABA. Answer: A. Mu-opioid. Chronic opioid use leads to desensitization and downregulation of mu-opioid receptors, reducing analgesic efficacy. 69. A 30-year-old female with multiple sclerosis experiences improved spasticity with gabapentin.
This drug modulates which neurotransmitter? A. Glutamate. B. Gamma-Aminobutyric acid. C. Dopamine. D. Serotonin. E. Acetylcholine. Answer: A. Glutamate.
Gabapentin reduces presynaptic glutamate release, decreasing neuronal excitability. 70. A 65-year-old male with psychosis develops hypersalivation.
Which neurotransmitter's excess activity causes this? A. Acetylcholine. B. Dopamine. C. Serotonin. D. Norepinephrine. E. Gamma-Aminobutyric acid. Answer: A. Acetylcholine.
Clozapine has weak anticholinergic effects, allowing acetylcholine to stimulate excessive salivation. 71. A 40-year-old female with fibromyalgia is prescribed duloxetine. This drug inhibits the reuptake of which neurotransmitters? A. Serotonin and norepinephrine. B. Dopamine and gamma-aminobutyric acid. C. Glutamate and acetylcholine. D. Histamine and opioid. E. Substance P and neurokinin. Answer: A. Serotonin and norepinephrine. Serotonin-norepinephrine reuptake inhibitors such as duloxetine alleviate chronic pain and mood symptoms. 72. A 55-year-old male with hypertension is prescribed methyldopa. This prodrug is converted to which neurotransmitter in the brain? A. Norepinephrine. B. Dopamine. C. Serotonin. D. Gamma-aminobutyric acid. E. Glutamate. Answer: A. Norepinephrine. Methyldopa is metabolized to alpha-methylnorepinephrine, which reduces sympathetic outflow by acting as a central alpha-2 agonist. 73. A 25-year-old male presents with agitation, rapid heart rate, and dilated pupils after taking a recreational drug.
Which neurotransmitter is most implicated? A. Norepinephrine. B. Serotonin. C. Gamma-aminobutyric acid. D. Acetylcholine. E. Glutamate. Answer: A. Norepinephrine.
Stimulants such as 3,4-methylenedioxymethamphetamine, MDMA, or amphetamines increase norepinephrine, leading to sympathetic nervous system activation. 74. A 70-year-old female with insomnia is prescribed trazodone. This drug antagonizes which receptor to promote sleep? A. Serotonin, 5-hydroxytryptamine 2A. B. A histamine, H1. C. Alpha-1 adrenergic. D. Dopamine, D2. E. Muscarinic. Answer: A. Serotonin, 5-hydroxytryptamine 2A. Trazodone promotes sleep through blockade of 5-HT2A receptors. 75. A 12-year-old male with autism spectrum disorder exhibits irritability. Risperidone is prescribed, targeting which neurotransmitters receptors? A. Dopamine D2 and serotonin 5-hydroxytryptamine 2A. B. Gamma-aminobutyric acid and glutamate. C. Acetylcholine and histamine. D. Norepinephrine and opioid. E. Substance P and neurokinin. Answer: A. Dopamine D2 and serotonin 5-hydroxytryptamine 2A. Atypical antipsychotics such as risperidone modulate these receptors to reduce aggression and irritability. 76. A 70-year-old male with Alzheimer's disease is prescribed memantine. This drug modulates which neurotransmitter to slow disease progression? A. Glutamate. B. Dopamine. C. Acetylcholine. D. Gamma-aminobutyric acid. E. Serotonin.
Answer: A. Glutamate. Memantineisan nemetildeaspartate, NMDA receptor antagonist, reducing glutamate excitotoxicity in Alzheimer's disease.
77. A 25-year-old female presents with dry mouth, blurred vision, and urinary retention after taking a cold medication.
Which neurotransmitters receptors are antagonized? A. Acetylcholine, muscarinic. B. A histamine, H1. C. Norepinephrine, alpha 1. D. Serotonin, 5-hydroxytryptamine 2A. E. Dopamine, D2. Answer: A. Acetylcholine.
Anticholinergic drugs such as diphenhydramine block muscarinic receptors, causing these side effects. 78. A 40-year-old male with treatment-resistant depression receives a ketamine infusion.
Its rapid antidepressant effect is linked to enhanced signaling of which neurotransmitter? A. Glutamate. B. Gamma-Aminobutyric acid. C. Serotonin. D. Dopamine. E. Opioid. Answer: A. Glutamate. Ketamine increases synaptic glutamate via N-methyldeaspartate receptor blockade, promoting neuroplasticity.
79. A 30-year-old female with epilepsy develops Stevens-Johnson syndrome after starting lamotrigine.
This drug primarily modulates which ion channel? A. Sodium. B. Calcium, T-type. C. Potassium. D. Chloride. E. Magnesium. Answer: A. Sodium. Lamotrigine stabilizes neuronal membranes by inhibiting voltage-gated sodium channels.
80. A 50-year-old male with schizophrenia develops metabolic syndrome while taking olanzapine. Blockade of which receptor contributes to weight gain? A. Histamine, H1. B. Serotonin, 5-hydroxytryptamine 2C. C. Dopamine, D2. D. Muscarinic, M3. E. N-methyldeaspartate. Answer: A. Histamine, H1. H1 receptor antagonism increases appetite and sedation. 81. A 60-year-old female with neuropathic pain is prescribed pregabalin. This drug reduces pain by inhibiting the release of which neurotransmitter? A. Glutamate. B. Gamma-Aminobutyric acid. C. Serotonin. D. Dopamine. E. Norepinephrine. Answer: A. Glutamate. Pregabalin binds to calcium channels, decreasing glutamate release in pain pathways. 82. A 35-year-old male with anxiety is prescribed buspirone. This drug acts as a partial agonist at which serotonin receptor? A. 5-hydroxytryptamine 1A. B. 5-hydroxytryptamine 2A. C. 5-hydroxytryptamine 3. D. 5-hydroxytryptamine 4. E. 5-hydroxytryptamine 7. Answer: A. 5-hydroxytryptamine 1A. Buspirone's partial agonism at 5-hydroxytryptamine 1A receptors reduces anxiety without sedation. 83. A 45-year-old female with Parkinson's disease develops hallucinations. Which medication's dopamine agonist effect is most likely responsible? A. Pramipexole. B. Benztropine. C. Levodopa. D. Selegiline. E. Amantadine. Answer: A. Pramipexole. Dopamine agonists can overstimulate mesolimbic pathways, causing psychosis. 84. A 20-year-old male overdoses on phencyclidine, PCP, and presents with agitation, nystagmus, and hypertension. Which receptor does PCP antagonize? A. N-methyldeaspartate. B. Mu-opioid. C. Gamma-aminobutyric acid A.
D. Dopamine D2. E. Muscarinic. Answer: A. N-methyl-D-aspartate. Phencyclidine blocks NMDA glutamate receptors, causing dissociative effects and autonomic instability.
85. A 55-year-old male with bipolar disorder is prescribed carbamazepine. This drug stabilizes mood by blocking voltage-gated channels for which ion? A. Sodium. B. Calcium. C. Potassium. D. Chloride. E. Magnesium. Answer: A. Sodium. Carbamazepine inhibits sodium channels, reducing neuronal excitability. 86. A 65-year-old female with overactive bladder develops confusion while taking tolterodine. Which neurotransmitters receptors are antagonized? A. Acetylcholine, muscarinic. B. Histamine, H1. C. Serotonin, 5-hydroxytryptamine 3. D. Dopamine, D2. E. Norepinephrine, alpha 1. Answer: A. Acetylcholine. Tolterodine's anticholinergic effects cause central nervous system butyric acid. E. Opioid. Answer: A. Glutamate. Calcitonin gene-related peptide interacts with glutamate pathways to mediate neurogenic inflammation in migraines. 88. A 5-year-old male with Dravet syndrome is prescribed cannabidiol. This drug enhances signaling of which neurotransmitter? A. Gamma-Aminobutyric acid. B. Glutamate. C. Serotonin. D. Dopamine. E. Acetylcholine. Answer: A. Gamma-Aminobutyric acid. Cannabidiol potentiates gamma-aminobutyric acid A receptors, reducing seizure activity. 89. A 50-year-old male with alcohol withdrawal is given chlordiazepoxide. This drug prevents seizures by enhancing which neurotransmitter? A. Gamma-aminobutyric acid. B. Glutamate. C. Serotonin. D. Dopamine. E. Norepinephrine. Answer: A. Gamma-aminobutyric acid. Benzodiazepines enhance gamma-aminobutyric acid A receptor activity, counteracting alcohol withdrawal hyperexcitability. 90. A 25-year-old female with bulimia nervosa is prescribed topiramate. This drug reduces cravings by modulating which neurotransmitter? A. Glutamate. B. Gamma-aminobutyric acid. C. Dopamine. D. Serotonin. E. Acetylcholine. Answer: A. Glutamate. Topiramate inhibits glutamate receptors and enhances gamma-aminobutyric acid, reducing impulsivity. 91. A 60-year-old male with diabetic neuropathy is prescribed duloxetine. This drug's efficacy is due to inhibition of which neurotransmitter reuptake? A. Serotonin and norepinephrine. B. Dopamine and gamma-aminobutyric acid. C. Glutamate and acetylcholine. D. Histamine and opioid. E. Substance P and neurokinin. Answer: A. Serotonin and norepinephrine. Serotonin-norepinephrine reuptake inhibitors like duloxetine alleviate neuropathic pain via dual reuptake inhibition. 92. A 40-year-old female with insomnia takes Ramelteon. This drug targets which receptor to regulate sleep-wake cycles? A. Melatonin, MT1/MT2. B. Serotonin, 5-hydroxytryptamine 2A. C. Gamma-aminobutyric acid A. D. Histamine, H1. E. Orexin. Answer: A. Melatonin, MT1/MT2. Ramelteon is a melatonin receptor agonist, promoting sleep onset. 93. A 70-year-old male with Parkinson's disease develops compulsive gambling. Which medication is most likely responsible?
A. Pramipexole. B. Levodopa. C. Benztropine. D. Selegiline. E. Amantadine. Answer: A. Pramipexole. Dopamine agonists like pramipexole can cause impulse control disorders.
94. A 12-year-old male with absence seizures is prescribed valproate. This drug raises levels of which neurotransmitter? A. Gamma-Aminobutyric acid. B. Glutamate. C. Dopamine. D. Serotonin. E. Acetylcholine. Answer: A. Gamma-Aminobutyric acid. Valproate enhances gamma-aminobutyric acid synthesis and inhibits its breakdown. 95. A 35-year-old female with fibromyalgia is prescribed milnacipran. This drug primarily affects which neurotransmitters? A. Serotonin and norepinephrine. B. Dopamine and gamma-aminobutyric acid. C. Glutamate and acetylcholine. D. Histamine and opioid. E. Substance P and neurokinin. Answer: A. Serotonin and norepinephrine. Milnacipran is a serotonin-norepinephrine reuptake inhibitor used for fibromyalgia pain. 96. A 50-year-old male with hypertension develops a cough while taking lisinopril. Which neurotransmitter's accumulation is responsible? A. Bradykinin. B. Serotonin. C. Substance P. D. Acetylcholine. E. Histamine. Answer: A. Bradykinin. Angiotensin-converting enzyme inhibitors reduce bradykinin breakdown, causing cough via irritant pathways. 97. A 45-year-old female with major depression is prescribed vortioxetine. This drug's mechanism includes modulation of which serotonin receptor? A. 5-hydroxytryptamine 1A. B. 5-hydroxytryptamine 2C. C. 5-hydroxytryptamine 3. D. 5-hydroxytryptamine 4. E. 5-hydroxytryptamine 7. Answer: C. 5-hydroxytryptamine 3. Vortioxetine antagonizes 5-hydroxytryptamine 3, reducing nausea, and agonizes 5-hydroxytryptamine 1A, improving mood. 98. A 30-year-old male with opioid use disorder is given buprenorphine. This drug is a partial agonist at which receptor? A. Mu-opioid. B. N-methyl-D-aspartate. C. Dopamine D2. D. Gamma-aminobutyric acid A. E. Serotonin 5-hydroxytryptamine 2A. Answer: A. Mu-opioid. Buprenorphine's partial agonism reduces cravings and withdrawal without full euphoria. 99. A 65-year-old female with Lewy body dementia experiences worsened hallucinations while taking haloperidol. Blockade of which receptor exacerbates symptoms? A. Dopamine D2. B. Serotonin 5-hydroxytryptamine 2A. C. Acetylcholine M1. D. Histamine H1. E. N-methyl-D-aspartate. Answer: A. Dopamine D2. Antipsychotics worsen psychosis in Lewy body dementia due to dopamine D2 blockade. 100. A 25-year-old female with generalized anxiety disorder is prescribed hydroxyzine. Sedation occurs due to blockade of which receptor? A. Histamine H1. B. Serotonin 5-hydroxytryptamine 2A. C. Dopamine D2. D. Muscarinic M3. E. N-methyl-D-aspartate. Answer: A. Histamine H1. Hydroxyzine's antihistamine effects cause sedation.